Right. The webinar is being recorded, so we should be good to go. All right. We just started this webinar. If anybody is joining us, we've got a lot of people who are in the active joining now. I'm seeing that participants number go up. So we're just going to hold for a minute here and give everybody a second to join. Some people also just get connected a few seconds late. So we'll just wait just a second here, and then we will get started with the panel shortly. Hey, Dimple's here too. I did hit record. This is being recorded, and it will be on our YouTube channel once I can trim it and get it onto the YouTube channel and get it downloaded and posted, which sometimes takes a little while, but we will send an email out to everybody letting you know that it has been posted, and you're welcome to share it as well. So in the interest of time, it is an evening discussion, and I know that people get a little sleepy in the evening, and it's also a beautiful evening outside too. So hopefully maybe some people are watching from outside on their patio. I'm Angela Cummings, and I am Executive Director for our AFSP Illinois chapter. And I want to welcome everybody who is watching this either live now during this webinar, or anyone who is watching the recording of this that we will post later. This is part of a panel series that we have here at AFSP Illinois that we call Unplugged with AFSPIL. And we try to do panel discussions quarterly about topics that are, topical, have something to do with what's going on at the time, things related to mental health and suicide, of course. And of course, June being Pride Month was a perfect opportunity to have this discussion tonight, which we have titled Supporting LGBTQ Mental Health Across the Lifespan. So we hope that you will find this interesting. And we are joined tonight by two of our DEI committee members. We have Dr. Dimple Patel, and we have Ann King, and they are both board members on our AFSP Illinois Board of Directors. And they are, as I said, on our DEI committee, and they're going to be moderating this discussion tonight. And we have great panelists. So I hope that you really enjoy this discussion. And for now, I'm going to go ahead and mute myself, mute my camera, and mute my microphone. I will be monitoring the Q&A. So if you have a question, and I hope you do, our panelists are really looking forward to answering questions. Absolutely put those questions in the Q&A. I'll be monitoring that throughout the evening, and I'll be also sharing things in that Q&A as well, certain links if we refer to them. So you can be looking in that as well if we have something to share. So having said that, I'm now going to turn it over to our fabulous committee and let you guys get started on this great discussion. Thanks so much, guys.
Thank you, Angela. You guys can all hear me, right? Perfect. Okay. Again, as echoing what Angela had said, thank you guys again for joining us. If you've been with us before, it's going to be a conversation, but we'll also have some questions prepared. But also, if you feel free to submit questions, or if you want anything else clarified, we will be monitoring and including those questions throughout. And we'll leave about 10 to 15 minutes at the end to answer questions. If anything comes up, we'll also be providing resources and any socials or contact information for our panelists. But I want to kind of just start right into introducing our panelists that are here today. Thank you guys again for participating and joining us today. I wanted to introduce Dr. Kyle Miller, as well as Matthew and Jen. And so I wanted to turn it over to Dr. Miller. If you can start and introduce yourself and like some of the work that you do, and then we'll go with Matthew and then end with Jen.
Thanks, Dr. Patel. Yeah, my name is Kyle Miller. I recently received my PhD in health education from Southern Illinois University here in Carbondale. But prior to obtaining this, and really throughout my doctoral work, I was working as a therapist and then clinical director for a behavioral health agency down here in the region that serves primarily youth and families who've experienced high levels of victimization. And so in that work, I got to do a lot of exciting things within the organization, changing policies, coaching, training, supervising. but then also being able to work with clients one-on-one, specifically a lot of youth and adults who identified as LGBTQ.
Hi, everyone. My name is Matt Heading-Hess. I am a licensed professional counselor in the Kankakee area. I work part-time at our local rape crisis center, Clove Alliance, and then also part-time with in a private practice called Transformative Growth Counseling. In my spare time, what little I have, I moderate or organize an online group called the Kankakee Area LGBTQ Network, which really just hopes to connect LGBTQ folks in our area with services and just support network. And then we host, a pride picnic in the summer and meetups throughout the year too, just to kind of provide some opportunity for social connection too. I'm also involved in a couple other mental health things in the area. I'm the president of the Mental Health Council in Kankakee County and a board member for our local homeless shelter as well. And yeah, that's a little bit about me.
Thank you. And Jen?
Yeah. Hi, everybody. My name's Jen Kafer, and I am a parent of 2 LGBTQ plus kids who has also had mental health struggles. So I have more of a personal experience with the mental health system. I also volunteer with Project Sun, which is a community organization helping families with youth in the mental health system. And I also help Matt with the teen group through the network that he had started. And it's like a teen social group that we are hoping to get off the ground and provide opportunities for kids to meet once a month and just hang out and make connections.
Thank you. And then I want to quickly join in and have Anne introduce herself as well and the work that she does.
Hi, I'm Ann King. I'm a member of the board of directors for the Illinois chapter of the American Foundation for Suicide Prevention. And then I'm also a board member for Project Sun that Jen talked about as well. And I do a lot of work with mental health because it's very near and dear to me. My son, I've supported him on his journey with his mental health. And I also work as a 988 chat specialist for the Lifeline.
Thank you, Anne. Yes, and so we're going to just jump right into questions, and we're going to start off with one of the conversations that I've had prior to planning this with all the participants was just around language and the importance of it. And one of the phrases that came up was affirming, and Matt and I talked about that a lot and how that's incorporated into our work as clinicians, but also into the healthcare system, and also respecting individuals' pronouns and how they're seen or how they want to be presented. And Matt, I wanted to have you kind of chime in on that a little bit more of just like how the significance of that.
Yeah, thanks. Yeah, so I think the conversation kind of came up when we kind of talked about the importance of how we can kind of work with people who are in the mental health systems and taking care of them when they identify as LGBTQ. The word affirming is one of those words that I think is used very often today to identify a lot of different interactions with LGBTQ folks. I know growing up myself, the word was to kind of tolerance. We want to be more tolerant of LGBTQ people, but that's of course shifted as acceptance has become more broad. And so, in the mental health field with clients, it's really important for us to be affirming. And I know one of the things that we mentioned was the difference between like affirming someone and acknowledging them. So like, I know I work with a lot of parents or even medical providers or other sort of therapists who say like, well, yeah, like I know that they identify as LGBTQ, I'm acknowledging them, but in what ways am I affirming them? I want to kind of challenge them to affirm. And so what that looks like would be like you mentioned, respecting pronouns, respecting names that they may use, changes in names, things like that, maybe information, pronouns and names that aren't on their medical paperwork, that aren't like legal documentation. Things like that can be really beneficial. affirming is just really important. And, I think of another space that's used is like within churches, for a church to be considered open and affirming, that's different than a church to be like, oh, we welcome everyone. It's actually like a really specific title about being open and affirming, meaning that they're actually, they acknowledge and are open to, they're going to affirm these folks that come to their church. And that's very different from just like, oh, you're welcome here. So that's kind of the difference there. Yeah, I don't know if anybody else has something else to kind of add to that, but.
Yeah, and Matt, I think you provide like a really great overview and definition and like really great examples there, and especially when we're talking about mental health too, thinking about ways that we can, sometimes turn that affirmation into like action and advocacy with them as well. So taking, for example, right, like working with a lot of LGBTQ youth, affirmation is using the correct pronouns when you're talking to the parents, right, who maybe haven't caught on yet. Working with them, hey, like your kid mentioned that they wanted to get a binder. Let's talk about how you go through that process, and let's look at it, and here's how you can help them with that process. So really, there's also coaching, I think, that goes on with the affirmation. That's a great addition to that.
I forgot I was muted. We actually have a question where somebody asked if a person says that they want to be referred by they and them, and for someone that might not know how to navigate that, is it okay to say their name, or how should they go about that process?
I guess, my suggestion would be to, if someone in your life that you care about uses pronouns that you're not used to or comfortable with, my recommendation would be to seek out education, get online, look up how to use those pronouns appropriately, practice. Maybe there might be a conversation with that person saying that, this might be a challenge for me and I'm going to work on it. But I think one option is to use their name instead of their pronouns. That is an option. But again, it kind of comes back to that question of affirming. Are we affirming their pronouns by trying to kind of skirt using their pronouns? I don't think that's necessarily as affirming as you could be. So my recommendation would be to seek out information, educate yourself so that you're using those pronouns appropriately. And have those conversations with those people. Most people that I know recognize that it might be a shift, it might be a challenge. I have that conversation with a lot of parents. It might be a change, and there might be a growing process in that. But effort is affirmation. That, like Kyle said, there's action that's required with that affirmation.
Yeah, and if I could just jump in, like something I did, because I have a trans child, is I practice their pronouns a lot in my head. So I would say things in my head about that child with like, oh, he is a great artist, or I would just practice it over and over. And if I made a mistake, I would apologize quickly. We made it clear we didn't want a big deal about it, was how he presented it. And then in my mind, I would make myself say 3 things with using the correct pronoun. And it just helps train your brain. And, most people will be patient with you if you're trying, and the effort is the affirmation, like Matt said.
Thank you so much. And so I want to jump into that a little bit more of another follow-up question, but in terms of individuals, I know Jenna mentioned that when her children had come out to her and how they have handled the process, but also within in therapy too. Have either one of you had cases or situations where you've navigated that, and in particular, if the family might not be accepting or affirming, more so the correct word of that? Or even are they scared to come out, and how can you navigate that? Or if somebody wants to, what would be an outlet for them to do it safely, or what would be your recommendation? Anybody can answer. This is a more general blanket question.
Yeah, I think there's a couple different things there, and I'll kind of speak to some work that I've done with adults, and really thinking about like specific case where I had an adult male, middle-aged, who had never came out to his family, and he had slowly started kind of like testing the waters with that, right? And I'm really going to speak to like a clinical focus here, but talking about safe ways that we can do that, right? Being in the office is a safe way where we can practice having that conversation and practice, hey, like what might happen. Really, if anyone's trained in like exposure therapy, like using exposure therapy to help somebody come out and rehearse those conversations, role play them, try it out with different people, and then coming back and getting feedback for that. In addition to that, kind of like some more affirmation is, as like a gay man myself, right? Like it's great for people to have a therapist that lives openly, that has, little like the pride Legos in his office, and that can talk openly about that. So if you are someone that you find in the audience, you yourself are part of the community, or you have somebody in your life, right? Like disclosure can be a valuable tool when used properly. And so using that correctly to help clients navigate some of those really scary feelings and those times that can be very difficult can come in handy. I'll kind of let somebody else take the rest of this.
Yeah, I would just add too, like, one of the main things that I make sure to mention when talking about coming out with young people especially is it's kind of acknowledging safety is like the #1 priority. Like I know that it's probably feels like really important to come out as soon as possible. I know a lot of kids just want to come out immediately. Like I tried to kind of like slow them down a little bit and think through like what are some of the risks that may happen? Like, are you risking anything by coming out, like financially, with your shelter, those sorts of things. Unfortunately, we still live in a world where people do kick their kids out for coming out, cut them off from finances, things like that. So we really want to encourage people to consider safety before coming out. And then, like Kyle said too, like it's really important to have a safe person, like maybe identify someone that that they'll be supportive and affirming, and do that first. That'd be, the first person maybe to try that out with, if that's your therapist or if that's a really good friend that identifies as LGBTQ also, or something like that. It is really a process. And the reality is, I love that you use the example of exposure therapy, because it's one of those things that's really scary in the beginning, but it's not something that just happens once in their lifetime. Like I still come out, I just came out, to everybody in this room, right? Like it's still something that can sometimes be scary, even as an adult who's done it a million times. And so that exposure is really important. The first couple of times are really scary, and that's why they're a big deal. But this is something that you're going to keep doing for the rest of your life, in some capacity. So I like that exposure therapy reference.
Matt, I wanted to follow up on something that you said about individuals wanting to come out quickly or rushing the process through it. Do you notice that more in teenagers and young adults, or what population do you see that more in?
Well, I mean, I think sometimes with teenagers, like when you think about like identity development and stuff like that, there's like a pride stage, right? Where people are really excited about kind of coming to terms with this part of their identity. And so they want to tell people, and they, once they kind of come to terms with it, they want to let that out. And so it's not necessarily specific to one population. I use the example of teenagers, but I think it's pretty common for people to want to kind of share this, especially with people that they care about. And it might seem counterintuitive for someone in a mental health role to say like, okay, slow down, like let's think through this and consider these the options. Like it might seem not affirming, but it's really important. I mean, we still live in a world, I mean, you're watching the news every day, where it's not safe to be LGBTQ everywhere. And so I just try to reinforce that safety is #1 always for those things. So.
Thank you. Sorry, Jen, Jen, did you have anything? You wanted to add there? Okay, perfect. So another thing to follow up on, I wanted to ask about like barriers. Essentially, we kind of like talked a little bit about it, but barriers to either coming out, but also in terms of care services. What are some barriers that you've noticed in like the mental health field But also on the flip side, as a parent, Jen, can you talk about your experience?
Yeah, sure. I mean, like I had shared with you that we had an experience when my oldest, we were looking for a therapist and we were desperate and could not, going through the list. And I was on Psychology Today and was like searching by who checked the little boxes, like, trans affirming, yada, yada, yada. And so I finally found one under the insurance. I'm so excited. I make the appointment. They have openings. And I go to my own therapist and I'm telling her about this person. And she's like, oh, no. And come to find out, this person had very vehement anti-trans beliefs, especially with children. And I almost sent my kid to this person. So it was, that was a holy, oh no moment for me that, I could have done a lot more harm than good by sending my child to that person. That's been several years ago, and now I've learned how to navigate and the questions to ask and, all those sorts of things. But there is a lot of barriers. There's barriers to, finding therapists who are affirming. There's barriers if your child has to be inpatient. I have a friend whose child just went inpatient and is not on the floor with their identified gender. And it's hard and it's very hurtful. And the mom is struggling, and I'm sure the child is too. And so there's a lot there, especially, I mean, in probably any community, but in a smaller community, you don't find therapists that relate, or, the goal is that the mental health support reflects the community they're serving. And when you have maybe a couple, therapists who do, there's not enough space for everybody. So it's a big challenge.
You're muted.
Sorry, I'll just kind of echo what Jen was saying there too. It's as a mental health provider, like it's very easy for us to check those boxes on Psychology Today and just say like, yes, I have experience in that or whatever. Some people go to 101 training and they feel like they're like LGBT affirming and those sorts of things. Unfortunately, that's kind of the world that we're living in, and it's an area where people want to have knowledge and people are seeking out therapists. So Jen, I would love if you would share some of those questions that you as a parent ask your therapist to find that out, because I think that's really important. But yeah, one of the reasons that I started the Kinky LGBTQ network on Facebook was exactly that. People will put themselves in the Facebook group and they'll ask all these LGBTQ people that are in this safe space, like, who do you go to for mental health providers? And then it's by word of mouth and by, referral in that sense, it's a lot safer to be able to do that. It's not foolproof, but it's a lot safer to be able to do it that way. So that's been really helpful. And I'll just speak to the fact that, unfortunately, one barrier is that it's still a subject where there are lots of people who have strong feelings. Both hospitals in our community don't have trans affirming health professionals. People in our community travel an hour north or south to get trans affirming care, which to me is 100% unacceptable. And I've had conversations with the hospitals about that. And unfortunately, it's not a priority on their list. And so it's one of those frustrations that it's a reality, but that sets a barrier to affirmation. It's a barrier to get the sort of help that you need because people, aren't willing, maybe have beliefs and biases against this community for whatever reason. So it's really frustrating, but that's a big barrier, like education and sort of like understanding and knowledge in the area of LGBTQ issues is a barrier.
And I will say too, you don't have to be a member of the community to be an affirming therapist. I mean, we have found that out. One of my children had a actual trans therapist who was amazing because the life experience. But then my other child has a therapist. Well, I don't really know what their identity is, but they have not shared it with me. But however, through her affirming nature from day one, I mean, she's on our side. And I know that she is looking out for the best interest of my child, period. So it takes work, I think. And also, I find with the people I've talked to that are younger, the younger therapists we've had better luck with, because to them, things are just, yeah, that's just the way it is. Like, you know, they're just more open, and they've let their minds kind of see bigger pictures than their small town that they, you know, maybe live in, or with their education, things like that.
No, thank you. And I think that like a lot of the things that you guys had are very important. I think the biggest part too, like we had talked about psychology today, and like it's so easy to check off those boxes, but then are you following through with what you as a clinician are posting on there? And especially I have had like through the clinical work that I do as a therapist, I've had patients come in that identify with within the LGBTQ plus community. And one of the first things I'll say is like, you know, identifying pronouns, but also if they feel comfortable, some will share it on their own, and which is helpful for me, but also of like, these are the words that are affirming to me. These are the like phrases that I like to use. And so that's helpful to me. But also one of the things that I'll ask as well is, do your parents know? And which pronouns would you like for me to use? But then I also ask for feedback. And as a therapist too, feedback is very valuable and very important and part of my process to grow. And with some of my patients too, I'll say like, I might not get it right away, or I might slip or mess up or anything. Feel free to either call me out or correct me or any of that. And that helps build that rapport, and also gives the individuals that I work with, or just in general, that sense of being able to give that feedback to somebody. So when you talked about that exposure and that role play, I'm like, use that in session, because that's a great way to practice. Okay, wasn't sure about I know like we're all muted here, so going into that, but no, absolutely. And I think that one of the other conversations we talked about is appropriate levels of care. So if somebody needs inpatient care and support, but they're not affirming or providing the support that they need, or placing them on the units that they need to be on, that they identify with, what levels of care do we go to next? What are the next options that parents can take? Or what would they want to do?
I'll jump into that and just say, you know, like, I love that you talk about levels of care, because one of the things that I've found to be frustrating is for a long time, I'll get people contacting me and saying like, oh, my kid needs a therapist because they just came out. And it's like, well, number one, just because they came out doesn't mean that they need a therapist. You know, what are the issues that they're facing? And oftentimes what I find is that really the parent needs the therapist to process through what they're experiencing. And the kid is actually doing much better. So I haven't figured out a really great way to say like, hey, actually you might need this, but yeah, that's oftentimes what I find. So just speaking on that level, you know, like really thinking through, does my child need a level of care? Do they need, you know, outpatient therapy or inpatient, whatever? So those are things to consider, you know, and as far as my community goes, I know one thing to consider is, are those levels of care always safe spaces for LGBTQ kids to go? You know, I know that's something we talked about, Dimple, as well, is that I sometimes have a harder time sending LGBTQ identified kids to inpatient because I know that they're not going to be affirmed in those locations. So I try to figure out what is something that we can work on, safety planning or whatever the case may be, to avoid that if I can, because those aren't going to be the safest and most affirming places. So it's all really kind of a complex thing to kind of discuss and think about all the time, because I want to make sure that my kid's not going to backpedal by going to a place like that where they're, where Jen just said, you know, they're not going to be placed on the program with their identified gender. They're not going to be, their names and their pronouns aren't going to be respected. And, you know, it's a really frustrating thing as a therapist in the community to realize that as a reality.
And I think too, at those times, like when you do have to send them right to those places where you know it's not going to, you know, they're not going to get the affirming care that they need, even going then and continuing that safety planning with the patient, with their family, and seeing if you have a good contact at those, if they're going to like one of the hospitals, right? Do you have a good contact that you can say like, hey, I want to speak to them every day that they're here? If you have that in your schedule, if you have the bandwidth for that, right? Like, just so that way they know, hey, I'm going to be reaching out, 10, 15-minute phone call every day, just so we can touch base and see how you're doing with that end of things. Talking to the parents, if the parents know about it too, right? Hey, like during those family sessions, like affirm your kid because they're not getting it there. So thinking about ways too that if we do have to use those resources, continue that safety planning.
Thank you. And kind of going into that too a little bit further, and it's a question, so I'm going to, a little lengthy, but I'm going to read it out for us. So within like the positive changes of societal acceptance of the LGBTQ plus community, people act as protective factors for mental health. However, there's a shift in acceptance has meant that many LGBTQ plus youth who come out or share their sexual orientation or gender identity at younger developmental ages, and which can impact their societal experiences and relationships. With that, like, what are some mental health impacts, particularly for youth who are not in supportive environments, that we need to be aware of? Anybody?
It is a lengthy question, so I hope I'm covering it.
Yeah, there's a lot in there too, and especially, but yeah.
Yeah, well, I mean, one thing that I know is that the more affirming people that you have in your life at these young ages, the more likely you are to the decreased risk of suicide later on in life. So I think that it's really important just to have affirming people. So if you can be a therapist to those people who's affirming, and that's a safe place for them, that is doing the work. I mean, I often say in like one-on-one trainings with people, just respecting pronouns is suicide prevention, because just affirming them in that capacity is it's getting an affirmation somewhere. I mean, I think I read a statistic somewhere that having one person decreases the risk of suicide. So I think that that's really important to kind of acknowledge that if you've got people in your life and maybe, that their family members aren't affirming, maybe you can be a person to kind of step in and be affirming for them. If that's a possibility. It's really important to have at the very least one person who is affirming and is going to use their name and pronouns and do the best you can, because there is a higher risk for LGBTQ folks to choose suicide. And so I think that's really important.
Yeah, and continuing to build that network too, whatever possible. Matt, I know you mentioned that you started like an online group, right? So getting familiar with what's available in your area is really important to be able to properly refer and make those connections. So down here in Southern Illinois, we have Rainbow Cafe, which is our LGBTQ center, and knowing, hey, they have Discord groups for the youth, right? So during the pandemic, they were able to do that, and they still meet and they talk regularly on Discord. So having that information to refer. Not just telling youth to like, hey, go to the Trevor Project, like get on the Trevor Project's website, look at all the different resources that they have available, because it's not just a hotline to call, and walking through, say, hey, here's some options that they have as well. And so helping them actually build that network can be very critical to reduce that, especially, like I said, suicide, but also looking at rates of depression, anxiety, rates of substance use, and like age of initiation being earlier among LGBTQ teens as well. And just recognize that like all those impacts are there, but if we can build that positive affirming network, we can maybe reduce some of that.
And so, thank you again. So I wanted to jump over to another question that was brought up about and related to following up with that. According to the CDC, high school students who identify as lesbian, gay, or bisexual are more than 4 times likely to have attempted suicide compared to their heterosexual peers. So what are some warning signs and risk factors specific to this population that we should keep an eye out for, especially like for parents, caregivers, therapists, teachers, anybody within the community, or even friends?
I mean, I think that the risk factors and the warning signs aren't too different from the general population, honestly. I mean, watch out for those young people who are withdrawing and especially around times of coming out. I mean, if a person is kind of going through a big transition, and having knowledge about what might be going on at home might be really helpful for you to kind of know what they might be experiencing. But I would assume that I don't have this in front of me, but I would assume that an unaffirming family would be a risk factor for sure. But otherwise, yeah, I don't think that the risk factors or warning signs are much different than the general population.
One of the things I wanted to point out and add into that too is just like keeping an eye out for social media posts or passive language or jokes that are made online, but taking them seriously, or even having a conversation, but also sharing it with a trusted adult or somebody like an affirming person within that you are connected to, and keeping an eye out for that too is also very important. Especially nowadays, there's so much on TikTok, Instagram, everywhere we see, and that also can tie into like cyberbullying. And is that something that even from like a parent perspective too, have you had your kids talk about that, or from the clinical side too, how much of that has impacted kids, and any ideations from suicidal ideations to even active plans?
Yeah, I think it does have a significant. Oh, Jen, want to go ahead? I'll be quick. Significant impact though does for LGBTQ youth, right? Still, it's really hard to work with adolescents who things are going well. They're starting to do this coming out process, and then they come to session one day, and it's like, oh, someone told me to kill myself because I'm trans. And I'm like, man, like that can really set somebody back. And like, how do you handle that in session with someone when we start to see all of these improvements come along, right? And then they hit you with that. And you're like, you know what? Like, that really sucks. Like, let's talk about this and let's process it. And again, like going back to, I love that, Matt, you made kind of affirmation a big topic in your talk, because I think that really is what we're going back to here. It's just still affirming them, and then continuing to look at ways to, hey, like, how can we manage being online? How can we change some of our online spaces to, right? We're not always going to be able to protect ourselves from that, but can we change our online spaces to ones that are going to be more supportive of us as well?
Yeah, that's exactly what I was basically going to say as a parent. A lot of our issues, because my kids don't have an issue with an affirming family. In our immediate family anyway, we'll say that in our household. But the bullying and all those sorts of things that have happened online have been such huge triggers for mental health issues. So I think my kids would have mental health issues no matter whether they were part of the community or not. I mean, it's genetic. We have it all now, both sides of our family. So it has really, it's correlation, causation, all that. But it is such a huge trigger. And I did have one of my kids, was told to go kill themselves by someone online. But yet online can be such a valuable place for them, because especially when we used to live in a town of 1,800 people, and there wasn't very many out kids at all. And so my oldest developed a community of wonderful friends from across the United States, that one of them actually came and spent Christmas with us this year. And that, I think, has saved their life. I really do believe these kids have saved their life, but we had to negotiate the ways to meet in the right way, and, and weed out the people that were hateful, and all those sorts of things. And it's a definite balance. But also, I think it's an invaluable resource that our kids can meet other people. So you just got to walk, you got to do the dance, I guess.
Something else that kind of came to mind when you were talking about the defamatory language that people will use online and things like that. We're also seeing that exponentially more in the news too, like Congress people saying those exact same things. And so, like, I just think about how much that's impacting people too. Like, it's scary for me to hear a congressperson say, I wish that we could line up all the LGBT or gay people and end their lives. It's scary for me, and it's really just wearing for me as an adult. And so I can only imagine what it's like for young people to see that and hear adults say things like that. So, we're also in like a social and political climate that is bullying in a lot of ways too, and maybe farther than bullying. You know, so I think that's also something to consider. I mean, people are getting it, unfortunately, from all sides, and young people especially are getting it from all angles.
And you can really talk, I want to end with this last question, and I'm going to transition it over to Anne, who's going to go further into parents and adult related questions. But we talked about the intersection between all these different areas, like from online to communities or to like in-person therapy or services and levels of care, but also touching base on the intersectionality between the LGBTQ plus community and the BIPOC community and the identities within that, and how it's also impacted with racism involved and receiving services. And as clinicians, like, have you had any conversations like this at work or even in trainings, and what's either needed or what kind of work have you done within sessions with your own clients?
So I'll kind of hit two parts of this, if that's all right. First off, right, like visibility. So especially like being in a rural area down here, right? Like it's hard enough for people of color to like find therapists of color as well. Like it's very hard. And a lot of our clients like will want that, right? And it's hard to find LGBTQ therapists if we're looking for that as well. So even like trying to intentionally seek out therapists who are going to help the populations that are asking for our help, even in a rural area, I find it very important from like an organizational standpoint. But also in session, right? Sometimes it's about us, maybe we're working with clients and we hear things that are racist that come up, right? And I know when Dimple and I talked, gave kind of an example of some things where I've had to like shut it down in session that like, we don't say that in my office. Like not here. When you hear somebody say that, that it doesn't go. But also on the other side of things, thinking of apps like Grindr or something where someone may put some language that's pretty harsh, right? Of like no whatever, right? They'll pick an identity and say none of that. Very racist, and having to like talk with clients about that, processing like, hey, like what happened? How did that feel for you to go through that and kind of see that happen? So I think those are, I know I kind of like talked broadly there, but two different things are like organizational issues, but also like working with the clients who have been on the receiving end of some of the racism, even within the LGBTQ community where it still exists.
And Kyle, just to follow up with that, I thought I was muted for a second. Can you touch base on your policy work within this area in terms of like adding on top of, in addition to the work that you've talked about?
Yeah, and really my like policy, I think, is more like organizational level, right? But also like working across systems. So organizational, thinking about policies, when we talked about, hey, do your parents know you're trans, right? Do your parents know what pronouns? That question's going to come up a lot. So working with, if you're in a supervisory capacity, right, working to change your organization's policy and make it clear for people of, hey, when you have a client, especially if we're talking about a youth who comes out to you, here's how you need to have that conversation with them. And here's the measures that we're going to take as an agency, as an organization to protect them. So I think that's a really important policy change that we can implement. So at our agency, we implemented a system, right? Hey, if they say my parents do not know this, we don't put it on their chart, right? I think a lot of electronic health records have the option now of adding the pronouns, which is great in there. But if they say, hey, my parents don't know, like I do not put that in the chart. If they, if they're assigned male at birth and they identify as female, like their parents don't know that, I'm not putting that in the system. Because at that point, like it's endangering the client and threatening, again, their safety, their shelter, everything like that. And then working across systems too, of kind of helping to develop networks. So working with like the health department here, a friend of mine is over there and she was creating resources, right? So, hey, here's LGBTQ clinicians in the area. So reaching out and providing some of those networks and giving access to a broader community, I think is a really important aspect as well.
Did anybody else have anything else to add to that?
I would just add, I think that's awesome work that you're doing, Kyle. And, I think people would be amazed to know like how many agencies I come into contact with who don't even have like a pronoun question or aren't even asking for, non-legal names or like nicknames, things like that. So that work is really important. One thing that I would just, a resource that I would like to kind of throw out there, the Illinois Safe Schools Alliance does a lot of work like that within the school realm. So like if you are a school person and you're looking at changing policy or kind of getting policy around those same questions, like what do we have to share with students, parents, and things like that, the Illinois Safe Schools Alliance is a really awesome resource in that system. So just wanted to throw that out there. They're just a cool organization in general.
Yeah, no, they're great. I'm glad you brought them up too for a lot of their trainings and stuff. And I wanted to also touch base on this Q&A, the question that we had come in about some of the anti-LGBTQ legislation targeting youth, and how this, is kind of a huge setback for us. And I'd have to agree, right? Like it's pretty scary, especially as a social worker. I'm thinking about down in Texas with the trans youth and the CPS like rule changes that they have down there. Like there's a lot of social workers down there that are in gray areas now that are trying to figure out how to process some of this, that are trying to figure out how to work with their youth and their families now, tiptoeing around that. In Illinois, I do want to say with like some other anti-LGBTQ legislation, right? Like conversion therapy, we ban that in Illinois, which is great, right? But sometimes if we're working with telehealth, we might be working with clients who are in other states where conversion therapy isn't banned, because unfortunately, like nationwide, we don't have that. And really what I'm getting to is a lot of legislations there, right? So making our voices heard when we're in these positions, right? If there's something going to like your state, like the state house floor, where you can fill out that witness slip in support or in opposition of it, do it. Calling, whoever your local legislatures are to help with that, very important. But also, right, looking at the recent Supreme Court decision, there's a lot of fear, even within my own household, of maybe seeing an overturning of sodomy laws that are still on the books in many states. Seeing, the loss of gay marriage, right? Sometimes like there's not going to be a lot that we can do right in the moment to solve this, but our clients, it's affecting their mental health. It's affecting our mental health too. And I know, Matt, you said the same thing, right? And I'm sure, Jen, as a parent, you're feeling that as well, that like it's our mental health is pretty rough right now with all of that. So even with the policies that are coming through, giving our clients that space to explore those feelings, because there's a lot there, right? There's anger, there's grief, there's fear. And it's really important for us to provide those spaces and recognizing that it's not just a law, it's not just Roe versus Wade. Like there's a lot at stake here for everybody.
Thank you. And I'm going to turn it over to Anne now.
All right, we're going to talk about adults now. And so the question I have for you, substance misuse or overuse, which may be used as a coping mechanism or method of self-medication, is a significant concern for members of this community. What are some helpful ways to offer positive support and encourage positive, healthy coping strategies for the LGBTQ adults who may be experiencing depression, anxiety, or other mental health conditions?
Go ahead, Kyle.
Yeah, I just talked. You can go ahead.
All right. The only thing I was going to say is I think that unfortunately, substance use is kind of unfortunately built into the way that the community historically at least has functioned, how they socialize, things like that. So I think, one thing that I've seen that's been hopeful is like organizations making sober spaces, or at least alcohol-free or drug-free spaces where people can meet other queer people and it not be surrounding alcohol or substance use. So I think that that's hopeful. Encouraging people to connect with people in those spaces is really important. unfortunately, you know, that statistic is very true. I mean, the community definitely substance use is a big issue within the community. So those spaces are really encouraging for me to know that those spaces are being created and coming more prevalent. So I think that that's a really good thing. It's the first thought that came to mind for me.
And I'd also like to add to that too, you know, identifying any like local harm reduction organizations that you have in your area as well. We're going to see a lot of LGBTQ clients with those agencies. In my previous work in one, right, like doing a lot of HIV testing, doing a lot of syringe access, and knowing what's available in your area, referring people in, hey, maybe sobriety is not going to be the thing for them if that's how they're coping right now. But figuring out ways to take that harm reduction approach within a therapy room can be very beneficial as well, to at least give them that space of like, hey, I'm not going to worry about the drug use right now. Let's maybe get you on PrEP because we know that you're using needles, right? So how can we reduce that harm? You know, my mind's blinking right now, but thinking of other ways like that, even again, continuing like testing for people and helping make those positive connections.
All right. According to the 2015 US Transgender Survey, 40% of transgender adults have attempted suicide in their lifetime, compared to less than 5% of the general US population. What do you think are some of the contributing factors and some of the warning signs and risk factors we should be aware of in the transgender community?
I think, you know, one thing is really apparent to me is this social rejection is a huge risk factor. Unfortunately, it's been, as you know, as long as these issues have been kind of come to the light, transgender people have been mistreated and not affirmed. And so I think that it's apparent in the legislature that we're seeing, that we just talked about. Unfortunately, you know, like I remember feeling what it was like as a young person who didn't anticipate that I'd ever be able to get married or have a family and those sorts of things. I think that unfortunately, trans young people still don't see the world as being very hopeful for them, and in most places. And so I think that we can do better to change some of those things, you know, whatever sort of advocacy work we can do to change those legislation. You know, unfortunately, I think that's the biggest thing. And I think it still is, it's still like a rarity to see a family who really just loves and embraces their trans kids. So I think changing, that's slowly changing, but too slowly, unfortunately.
Does anyone else want to weigh in on that, or are we ready to move to the next question? Okay. So we have seeking mental health treatment can be particularly frustrating for this population due to the lack of providers who specialize in LGBTQ plus mental health issues. What are some questions LGBTQ plus people should ask a mental health professional during their very first appointment?
Jen, I'm going to ask you to answer that because I know you brought that up already, and I would love to hear the things that you feel like should be asked.
Yeah, well, I don't have a list per se. I guess I said I had a list, but for me, it's very important. I just get straight to the point. And as a parent, it's a little, I think, easier for me because I'm taking the emotional labor in that situation of being like, you know, I will ask a therapist, I said, what are your views on LGBTQ folks? And how do you believe that children can come out at any age? And do you believe that, you know, what organizations do you belong to? Those sorts of things. You know, if you have a religious background, are you able to put that aside, you know, to offer, you know, objective care to someone that is coming into your office? those sorts of things. Definitely ask if they have experience working with the population. And I usually try to sense just how comfortable they are, because a lot of times when you ask people questions, if you could tell if they're uncomfortable, and if they're uncomfortable having those sorts of very simple questions with me, then it's not somebody that I want having deeper conversations with my child. I think it's important to, kind of just get to the meat of it. And I, as someone talking about like adults going in for that, and that's a very vulnerable state when you're going in. I mean, I go to therapy too, and it's vulnerable for me to go in and, open up about everything. And so I can't imagine having to seek that part out as well. Be like, okay, I'm here, I'm saying I have all these struggles, but then yet there's this other part of me that I want to make sure that you're okay with. And so I don't know how to give that advice, I guess, to an adult, but as a parent, I've gotten very good at being an advocate for my child. And that's just another, space for that. But
yeah, and as far as adults go, like I try to, unfortunately the systems and the way people access mental health care, this isn't necessarily set up like this, but it's really important for people to view their first couple sessions with the therapist as an interview themselves. Like, you want to ask those questions and see if you're having a good vibe with that person, and if their views do align, at least in that capacity, with yours. So, I wish that the systems allowed that a little bit more, for that sort of interview process to happen, and not, not feel like you had to be charged the first session or something. I don't know what the easy way to fix that would be, but but I encourage my clients to feel like those first sessions are an interview for them. I want to make sure that they feel like it's a good fit with me.
And I would also say, like Matt said, creating like the network that we had is the word of mouth is the best way to find out who could be a good therapist for you or for your child. I do volunteer with the Project Sun, and so I've met a lot of people through there that I can kind of be like, what do you know about this person, or what do you know about that person? And not everyone has that, advantage, but just, talk to people in your community and try to figure out, who is the safest, person for you to be with, because it's very intimidating.
All right, I think we're going to transition to our parents and caregivers questions. So some of this Jen talked about a little bit earlier, but we're going to just double up on it here. So where can parents, caregivers go to find support and help educate themselves so they can better help their LGBTQ plus family members?
I would say the very first thing I would stress to parents, caregivers, is, your feelings and your reaction and all of those things around the subject, that's yours to bear. So let's not put that on our kids or whoever else is in our care. There's lots of good resources. There's tons of private Facebook groups. And sometimes you got to kind of feel out the group to see if it's something that you're really interested in. But I have made some really good friends and gotten some really good advice from those folks. PFLAG is an excellent organization that does support groups for parents. I'm trying to think. Like, I belong to Ally Parents, which is for parents of trans children. That's a great support group for me. The pandemic has been great for me because I've been able to join support groups that I've never been able to join in the past, because there's nothing close to it. I mean, that is, that's the only good thing I could say. But I mean, that's one thing that we, like, as parents who have been through this for a while, is we just stress to our fellow parents, our young people have it hard enough. So this is our burden. If we need to, get our own therapist and talk about our own stuff, your own, things, you deal with that. And then your child be affirming, and then go seek out your research, and don't just seek out reputable, trusting places and affirming places. depending on where that might be.
And we'll send out, unfortunately, our chat box is disabled, but we will send out a list of all the resources that were mentioned here and additional ones as well.
All right, so Jen, you talked about this earlier, but we're going to talk about it again. How important is the language that is used at home?
It's extremely important. Because I have trans child who has trans friends, I kind of get like the personal stories of a lot of things. And it's bad for some kids. It really is. Kids hear, they hear their family members telling trans jokes and homophobic jokes. And, maybe people say it just in passing because they don't even, because to them, it's just normal language, the way they speak, but they don't think about how that feels to their child. And it's super important as a parent. That's our job as, if we're at an extended family gathering, or if we are anywhere, that we correct people, that we're the ones that, we have to teach our kids that, like I think Matt said, you're going to be coming out the rest of your life. So you do have to kind of start to get comfortable with it. But it's also our responsibility as the parent to take some of that emotional labor off of them when they're young and be like, no, that's not acceptable. Or, he is, his pronouns are he, him, or, his name is this. And for us to take that very firm stance, because it saves lives. Using correct pronouns saves lives, plain and simple. I mean, it's something that people can make a really big deal about and be like, well, it's really hard for me. Okay. There's lots of things in life that are hard. I mean, I know people who got married and all of a sudden you change Mr. or Mrs. last name or whatever. You seem to be able to pick that up. How come you can't, practice this and get it right? Because it is just so important. And when you could do something that simple that makes someone feel like they are valued, why you wouldn't want to do it is beyond me. Sorry, that's my soapbox. I get passionate about that.
Right. Anyone want to add anything else to that? Or did she cover it pretty well? Okay, so this next one is from you, Jen. Be aware of how the system of care represents the community.
Yeah, and I think we actually talked about that a little bit earlier about, not being able to find the, affirming therapists, or that, how the mental health services don't, represent the kids, things like that. And it's something that some communities are actively working to fix, not fix, to improve, because I don't think it'll ever be fixed. But here we do have a cultural competency group that is working on bringing more, therapists who are people of color, queer therapists, all these sorts of things. So that way, when you want to go to a therapist, you're more comfortable in seeing, someone like you as your therapist, or in any other mental health professional.
Anyone want to have anything they want to add on that? Okay, so what if parents are not supportive? What can our youth do, and what kind of challenges may or can arise?
I think going back to the safety aspect of it, right, of making those plans with them. I like, Matt talked about kind of slowing them down, which is definitely a hard thing to do. So I think just going back to what Matt said with that.
Yeah, and I would just add too, it's okay to create, sometimes it's important to have conversations where with young people, especially, there are times when I don't feel safe to come out, or I need to kind of acknowledge that there are going to be places that are not safe, and I'm going to face critique and criticism from people, those sorts of things. And so it's kind of very gently and affirmingly encouraging people to kind of develop a thick skin, because unfortunately we live in a world where you, as an LGBTQ person, need it. sorry, I just lost my train of thought. It's getting a little late. But that I think it's just really important to kind of have those conversations with them about the reality and kind of creating a safe space in the therapy session or creating a safe space at school. Like if you're a school social worker or a teacher, acknowledging that, you may not have the support at home, but we can kind of do our best to kind of have safe spaces and affirming spaces for you, and being safe people to do that. So I think that's really important. It's something that we can do as allies. I think that's a great a role of an ally, is to kind of help create those safe spaces for people, if possible.
Perfect segue into a question that some participant had asked, and one of our final wrap-up questions within this too, of what other things can allies do? And I think we've kind of touched on it throughout the presentation, throughout the questions and some of the answers that you guys have shared, but what are additional things that allies can do? Or in particular, I know that one of the things is educating and having either taking those classes or going to your 101 presentation, or even through our conversation that we had. I was like, wait, affirming, that has never come up in any of the training that I've done as a clinician. And that was something I learned. And then I started using like right away with my conversation with Kyle. And like, it was like an hour or so later, next day. And I'm like, oh yeah, implementing right away in. But, I see Jen laughing because I did the same thing too. I'm like, all right, got this. But even then, what are other things that even clinicians can do, communities can do, and what defines an ally?
I think in terms of, what we can do, right? And this is kind of more of like a general demeanor or approach to it. But it's just like approaching it from like a space of openness, that like, you're going to mess up and that's okay. Right. That's a really hard thing that sometimes, thinking back, the question of, getting kind of confused, right, with they, them pronouns. And that's one that I think we hear fairly often. And it's not an uncommon feeling for people. It's just like challenging yourself and putting yourself in that uncomfortable position to maybe say it incorrectly, but then learn from it. And I think that, for being an ally, like that's one of the best things that keeps you in that like learning mindset, right? That I don't know everything, but I'm trying and I'm really making that. So I think for me, that would be probably one of the biggest aspects, is just changing that approach to it.
And something I would add is it's not for everyone, but using your privilege or your space to kind of speak up and say something when someone in your life is saying something wrong, when someone in your life is saying something mean or hurtful, correcting them, saying something. I mean, using your ability to say that, so that it's not relying then on the queer people in your life to have to stand up every time and do that. And I think also just normalizing these conversations, like the reality is everyone has a gender identity and a sexual orientation. So like, I know what we like to say, like, this is a community, and like people that identify outside of straight or cisgender are not LGBTQ, but everyone has a sexual orientation and gender identity. And so having conversations, like starting conversations with my pronouns are this, this, and this, even when you're a straight or cis person, normalizes that part of the conversation. And so it's a good thing to kind of have those start those conversations with things like that. So, I know that the question kind of also made reference to like the rainbow marketing and those sorts of things, which I know a lot of people get frustrated with, but I also think about, as someone who grew up in the middle of a cornfield, how much of an impact it would have made on my life to see a rainbow t-shirt at Walmart in high school. Like, even though I know it's frustrating for these companies that maybe don't benefit the community year round, it does make a big difference. It is affirming to go into Target and see this huge, display of pride things. So, that sort of thing is like taking up space to normalize this stuff and make it just part of who we all are.
Yeah, absolutely. And I think, also, I think we should just all be more like non-assuming of, when you meet Joe, don't ask Joe about his wife or girlfriend. Just say, hey, Joe, do you have a partner? Do you, whatever. Just like changing our language around all things gender identity, sexual orientation, whatever. Just making it like, I don't like when I hear my kids talk to people, they like don't assume anything about anybody. And I think that's awesome. I mean, they're just like, tell me who you are, let you know, whatever. And it's like so cool. And that's one good way I think we can all work to become allies, is just and to do the work sometimes ourselves. Like, don't ask all the queer people in your life to educate you about, you know, about this sort of thing. I mean, if you're someone you're comfortable with and you have a certain question, of course, but it's like, we need to take, and when I say we, I mean a cis het person like myself, I need to take some of that work and take that burden off of somebody else and be like, let me figure this out. You know, how would I feel if this was me? Because that's, in reality, that's what it is. I want everyone to be treated the way I want to be treated. So if someone was saying that about me, how would I feel and how would I want to respond? And that's what I should do.
Speaking of that, I realized I didn't even, when I joined it, because I had to re-download Zoom on my computer, and my pronouns were not even in here. So as you guys were talking, I made sure to add it in and save it for future meetings. So here we are, doing it right now. But to end with, the final question I have is there anything that we didn't ask that you guys would like to touch base on? Any final thoughts?
Just one final thought I would like to say is, and then we kind of touched base about like legislation and all these things, but you know, vote to protect the people in your lives that have a chance to lose rights. You know, like voting, I heard someone say today that voting is like the walls of the house and then the roof. So it's like, if we don't vote, if we don't work on all these things, the roof falls. And we really need to understand that legislation and decisions can affect people and their mental health, and it can really impact, you know, their safety and how they feel. And it's just so important to protect the people in your life that, you know, need that extra bit of protecting. Because if, you know, if you've never had someone decide if your rights are valid, if you've never had the Supreme Court say if you could be married or not, you don't know what it feels like. You don't. So, and that's a privilege, right? I have that privilege. And I just hope everyone can kind of see that when they have it, you know, in those situations.
Echo that. And the only other thing that I would say is just like, I appreciate the Illinois chapter for doing the talk back like this. I think it's just really important to have these conversations, especially within systems and organizations, just, you know, including LGBTQ, you know, BIPOC folks, those sorts of things as well, just including them in the conversation and having conversation is really helpful. You know, it just starts a conversation. So I appreciate you all having us and doing this.
Yeah, this was really enjoyable to get to speak with all of you and get to answer these questions. And I don't have any final thoughts that Jen and Matt haven't already said. I think both covered it all pretty well.
Thank you. And again, from all of us at AFSP Illinois, we are very thankful and appreciate you guys spending your time with us this evening. I know we went a little bit over, but thank you again so much for taking your time out for joining us today. And we will send out an email just with all the resources that we have and any additional ones that were shared. And then also please do visit AFSP.org for additional resources too. There is a Talk Saves Lives for the LGBTQ plus community. And so you can also become trained in that. I don't know when our trainings are to train in giving that presentation. And that's another, like Matt had said, another way to get the word out in the community. We also have like our general Talk Saves Lives presentation as well. And it's great to get those words out there, like the support that's there, but even basic stuff like we talked about language, what kind of affirming a lot of the big takeaways from this as well, and even what kind of support there are, but also community in terms of like who's going to who for therapy, or talking to your therapist and knowing like, okay, it's a big community, but a small community within therapists too. And so sometimes a word of mouth is also a great referral source as well. And also depending on your insurance, like call your insurance company and look up benefits. What are your mental health benefits? And do they cover telehealth? Is that an option? And also I know final thought on this too, if you don't feel safe at home, being able to join on from a telehealth session, like can you go outside or in your car or somewhere else to where you can have that privacy? So those are some other ways to still receive support too. And with that, we wanted to say thank you again. And our panelists, you can stay on for a quick picture for us.